Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello. Thank you for joining us for this webinar, which is going to help you grow your home care business through specialty programs. In this time of constant change, we appreciate your time as you invest in growing your business. My name is Laura Barnett, and I'm on the marketing team at Axxess. Before we get started, I'd like to tell you a little bit about Axxess. We're a leading technology company serving organizations that provide care in the home. We offer a complete suite of easy-to-use, innovative software solutions empowering home care, home health, and hospice providers to grow their business while making lives better. If you have a question during today's webinar, please submit it through the chat box, and if we have time at the end of the webinar, we'll answer that. If not, we'll follow up with you after the webinar. Today, you'll hear from my friend and colleague, Lisa Malone. Lisa is a registered nurse and is a clinical product manager for our home care solution. She has a wealth of expertise across the home care spectrum to include compliance, administration, clinical team management and education, as well as patient safety. Lisa, I know you have a jam-packed agenda today, so take it away.
Thanks, Laura. And hi, everyone. Thanks for joining us today. I'm excited to talk a little bit about growing home care revenue through specialty programs today. So our objectives for today, we're going to explore changes in demographic workforce demands and trends for care in home care organizations to develop innovative ways to think of the future of recruitment and retention of caregivers. I know that's something that's always on our minds for home care. Through understanding the needs of specific stakeholders in disease management, home care agencies can develop specialty programs which will diversify business and create revenue streams. And then using a transitional care as a model, specialty program home care agencies will understand how to market to various stakeholders. So at Axxess, we believe that the future of healthcare is in the home, and I'm sure that many of you would probably agree with that statement. But let's look at making a case for home care. So we know that 10,000 Americans become eligible for Medicare every single day. That's 3.6 million per year. People who are older, maybe sicker, and have multiple costly chronic conditions and specialty medications. We know that there are changes in home health reimbursement. We've seen that with PDGM and how that has maybe wreaked havoc on many home health agencies. We know that Medicare Advantage plans are beginning to provide coverage for caregiving services, which is a great option. We know that the total national health expenditures are expected to be this year in 2020 about $4 trillion and expected to be about $5 trillion by 2025. We also know that the average age of a nurse is 50 years old and that the average tenure of a nurse in a post-acute care setting is only 18 months. 2015 was the first time nationally that more money was spent on home care than on nursing home care. So that shows really a cultural and financial shift towards home and community-based care. So let's talk about some numbers. 47.8 million, that is the number of people aged 65 and over in the US on January 1 of 2015. So this group accounted for about 14.9% of the total population. And that age group, 65 and over, the population grew 1.6 million just from the previous year, from 2014 to 2015. 92.8 million is the projected population of people aged 65 and over in the year 2060. So that's a big jump. People in this age group will comprise nearly 1 in 4 US residents. And of this number, almost 20 million will be age 85 or over. And then the last two columns there really are just talking about percentage of education. So 82.8% is the percentage of this population, age 65 and over, in the year 2015, who had a high school degree or higher. And then 25.8% had a bachelor's degree or higher. So we see that a large group of the population is aging, is moving into the 65 and over group, and that they're more educated than ever. I would fully expect for those numbers, those percentages of education to increase. So what are the pillars of success for home care agencies and starting specialty programs? We believe people, promoting, and processes. If you focus on your people, promotion, and developing clean and clear processes, it's really a way to create success when starting a new specialty program. So let's talk just quickly about the trends shaping the future of work. This is really interesting to me. So we've got 5 trends that are shaping the future of work here. First is new behaviors, so shaped by social media and the web. Wow, we are living more public life than ever before on social media, right? People engage in vigorous debate on Facebook. They post pictures on the regular on Instagram of everything from what we're wearing to what we're eating. We're snapping pictures of it and posting it for everyone to see. And we have our entire resume and work experience posted on LinkedIn. So we're living more in the public eye, and businesses as well are changing the way that they share, communicate, collaborate, and create content. Number 2 is technologies. So there is definitely a big shift to the cloud and big data, using collaborative technologies, wearables, all the information that we can glean and all the things we can do just from this little thing wrapped around most of our wrists. Technology really enables everything else to function these days. Number 3 is the millennial workforce. Millennials comprise about 50% of the workforce this year in 2020, and they're expected to be about 75% of the workforce in 2025. And as you can guess, millennials are digital natives. They have grown up using technology for really absolutely everything, and they want to work and expect to work in ways that are current. So really, they're driving organizational change. Number 4 is mobility. Mobility is allowing us to stay connected to people and to be productive anytime and anywhere from any device. We used to go to work at a building, at an office, and now often we're able to conduct business right from the device that fits in our pocket. And then finally, number 5 is globalization. Things like where you are physically in the world and the currency you use and even the language that you speak are really just starting to matter much less. So the changing workforce demographics. This was done by the Pew Research Center back in 2015. The largest share of the American workforce is millennials. And here, as I said, this was 2015. So this says 35% millennials, as I just mentioned. Now in 2020, it's really already about 50%. But we'll take a look at this. 35% millennials, 34% Gen Xers, 29% boomers, and 2% traditionalist. So for the first time in our history, there are up to 5 generational groups working side by side, because we also have Gen Z now. The oldest Gen Z members have entered the workplace. So managers and leaders are really met with unprecedented challenges as each generation has its own lifestyle, life stage, communication preferences, and priorities. Managers and leaders are being asked to understand, communicate, train and retain 4 or even 5 different generations at the same time. So leaders who possess these skills are becoming increasingly in high demand, definitely across all industry sectors. So let's talk about some numbers in home care. In an article published by Home Healthcare News in late 2017, they stated that almost 40% of patients with home health instructions did not actually receive home health care. That equates to about $2.5 billion in lost revenue for home health agencies. The home health care industry is missing out on billions of dollars in revenue from patients who are recommended for home care after discharge, and then they never receive it. So there's a huge opportunity there, obviously. That is according to Axxess Health. They provide healthcare analytics for home health as well as hospital and hospital sectors. And some of the reasons for not receiving home health care for these patients: insufficient understanding of the home health value proposition. They just didn't understand the benefits of that. Breakdowns in communication, maybe between hospital clinical team and discharge planners, maybe even the labor shortage for discharge planners, as well as insufficient follow-up after discharge. And it's obviously not just about the missed revenue. It's also about quality of life for these seniors. Nationally, home health adherence is found to be about 68%, and adhering patients were 29% less likely to be readmitted to a hospital compared to non-adhering patients. So patients are more likely to be readmitted after discharge when they don't receive home health care. The home health care market is expected to grow to about $528 billion by the year 2026. So the population of senior citizens will increase to about 69 million in 2030. There will be about 1 in 5 Americans will be senior citizens in the year 2050. So an estimated 86 million people will be 65 or over. So the need is definitely there for home health and home care services. So let's look at healthcare occupation projections. According to the Bureau of Labor Statistics, these are the healthcare occupation projections for the year 2028. And if you take a look right in the middle of the chart here, you'll see home health aides. Employment in 2018 was about 832,000. Employment projections for 2028 is a little over 1.1 million. So that's an increase by almost 305,000. And the percentage change from 2018 to 2028 is 36.6%. You'll see that that's the highest on this list of healthcare occupations there. And then if you look down 2 rows, you'll see personal care aides. They're the next highest percentage of increase at 36.4% of an increase from 2018 to 2028. So home health aides and personal care aides, big growth opportunities for both of those occupations. You'll also notice in the last column, the median annual wage in 2018. The 2 that I mentioned, home health aides and personal care aides, unfortunately are the 2 lowest wage earners. So that's something to consider as well. And then this is a graph of healthcare occupation projections. So this was also Department of Labor, Bureau of Labor Statistics put this out. And this is a graph between 2014 and 2024. So we're already a little halfway past, or past the halfway mark of this. The turquoise color is new jobs, and then the green is replacement jobs. So as I stated already, the average age of a nurse is 50 years old. So there will be a large number of replacement nurses, registered nurses needed due to retiring nurses. As you can see that there's going to be about 3 times as many personal care aides, the next row there, new jobs, just because of the growing demand, as well as some replacement jobs. And then if you look 2 down, is the home health aides. We're going to need many new jobs and replacement jobs for home health aides. So the future is bright for healthcare occupations for sure. And then here's another quick graph. Estimated change in the US and global populations by age from age 2010 or from year 2010 to year 2050. And this is in percent. So the grayish color on the right is age 65 and over. So in the US, the population age 65 and over is projected to increase by 111%, up to, as I said, 86 million in the year 2050. So all of those numbers add up to really great opportunity in home health and home care. So let's talk about recruitment and retention. Things that matter for recruitment and retention: pay, meaningful work, a career path, and transferable skills. So a survey done by Q5, and they're experts in organizational change and helping build better businesses worldwide. They did a survey. What is the biggest factor that makes recruiting caregivers difficult? And as you can see, far and away, the most chosen answer was lack of qualified caregivers. And for any of us on the call today, I'm sure we would agree, if we've ever had to hire qualified candidates or worked at a business who did hire qualified candidates, that we would totally agree with this. So how can we source caregivers? Well, nursing schools is a great option that maybe you've thought of or maybe you haven't. Many students at nursing schools want to work in the field. They're already passionate about it. They see it even as part of their learning experience as students. So working as a nursing assistant or a home health aide or a personal care aide is a great option for them, and they really like doing that. When I was in nursing school, I was a nursing assistant as well. The military, you can look at military or retired military, churches, and displaced workers. And unfortunately, right now we have a lot of displaced workers, so that there's definitely a potential there. So caregivers want to know that you're investing in them and investing in their career, and they want to feel confident in what they're doing. And training is a large key to retention, I believe. So ways to provide training and education are online platforms, in-house clinical staff. You could create an in-house skills lab. For non-medical caregivers, you can create a skills lab fairly inexpensively. You know, a mannequin is probably your highest cost for that. You may even be able to get donated wheelchair or walker or canes. You can inexpensively buy a blood pressure cuff and thermometer and things like that, a gait belt, and then have an in-house skills lab where you can train and maybe verify competency for these non-medical caregivers. I think that's a great option. You can use consultants. Also, home health and hospice organizations can assist with this sometimes with training. Other subject matter experts. You can use some of your partners in care, and we'll talk in just a minute about who exactly are your partners in care in this venture, and then even telemonitoring. So the methods of growth for home care agencies is acquisition, expansion of a geographic area, and then increasing revenue streams. So disease management is basically what we want to do. So let's talk about the goals of disease management. Creating structured treatment plans that aim to help people better manage their chronic disease and to maintain and improve their quality of life, which to reduce the symptoms associated with chronic disease and keep them from getting worse, to prevent complications and accompanying diseases from developing, and then just overall improvement in the quality of life. So who are our partners in care for disease management? Home health organizations and home care organizations can partner together. Hospice, hospitals, definitely, doctors' offices, patients themselves and family members, rehab centers, and even payers like Medicare Advantage plans and commercial insurance are all your partners in care and are just as equally interested in disease management. So the stakeholders for disease management, which is a person with an interest or concern in disease management. Hospitals, we know that Medicare payment is withheld for readmission to hospitals. So hospitals definitely have a vested interest in disease management once their patients leave the hospital. Nursing homes are compared with others using standardized tools. Skilled nursing facilities, they have Medicare payments tied to outcomes. Assisted living facilities, they have regulations that require certain functionality to remain in the ALF. Home health and hospice have the compare reports. And then rehab centers have value-based purchasing models. Physicians obviously are concerned with the care of their patients. Patients have a desire to age in place. And then payers, of course, want to reduce spend rate. So these are all stakeholders in disease management. So what are some ideas for specialty programs? Well, they can include senior safety, and that can really encompass a lot right there. But some specifics would maybe be a dementia program or specifically Parkinson's or diabetes. You can have a care transitions program transitioning from a hospital or facility to the home. Rehab, even cosmetic. Think outside the box a little bit. There are cosmetic procedures happening all the time that people may need just some assistance, maybe for 2 to 4 or 6 weeks after a cosmetic procedure that home care may be able to help with. So here are 3 of the top causes of hospitalizations: falls, medication mismanagement, and improper disease management. So we'll take a look at ways that specialty programs can assist with decreasing hospital risks for each of these. An important part of specialty programs is showing value. The industry is all about pay for performance or value-based care, right? So having documentation that supports each of these, return on investment, data analytics, and clinical outcomes of senior safety is vital. This is also where having the right software partner to capture all these data and document it is really helpful. So let's start with falls. The cost of older adults falling is staggering. You'd be surprised. Each year, about $50 billion, with a B, $50 billion is spent on non-fatal fall injuries, and another $754-ish million spent on fatal falls. And that's according to an article in the Journal of American Geriatric Society. So who's at risk for falls? Well, the answers may or may not surprise you. People on 3 or more medications. There's a lot of people on 3 or more medications. People who live alone, people with pets, people with chronic diseases such as high blood pressure and diabetes, people in cluttered home environments, people who eat or drink in adequate amounts, people with unsteady gait or who need assistive devices, people with vision problems or pain, people 65 or over, and people with one or more functional limitation. Also, falling once doubles your chances of falling again. And fear of falling often causes a person to decrease their everyday activities. But of course, when activity levels decrease, people become weaker, and therefore that further increases their chance of falling. So a specialty program could involve creating and educating with general fall prevention tips. Things like when you first wake up, sit on the edge of your bed, make sure that you're not dizzy before you stand. Eat breakfast every morning. Skipping a meal can make you dizzy and therefore increase your risk of falling. Use a cane or walker if you're unsteady. Promptly replace worn rubber tips of these devices. You know, that seems like an easy one, right? If somebody has a walker or a cane, they should be using it. And I can tell you from experience, people think that they can get around their home even without that device. They know it well, they know their home well, and just don't feel like they need that device until they go outside. But as we know, lots of falls happen in homes. Be careful around pets. Obviously, they can kind of run in front of you or jump up on you. Wear clothes that fit properly, and don't leave clothes or newspapers on the floor. Some more tips: close cabinet drawers and doors so that you don't stumble over them. Remove throw rugs, extension cords, and other floor clutter. Again, floor clutter, that sounds easy, right? But sometimes when it's more taxing to get up and walk into the other room, like if you use an assistive device or have an unsteady gait, or get out of breath easily, seniors may decide, you know what, I'm just going to stack that up right here for now, and I'll bring it back into the bedroom the next time I go back there, and then just forget to the next time they go back there. So I've definitely seen homes where things are stacked up all over the floor, and people are aware that it shouldn't be, but we do it anyway. Wear low-heeled shoes with non-skid soles. Tying shoes with a snug fit is preferred. Avoid shoes with thick or heavy soles. And then diabetics, they definitely need to take extra precautions. They have many times peripheral neuropathy, which causes a numbness in their feet, which affects their ability to feel the floor or to feel stairs as walking up, and can cause balance problems and ultimately falls. So preventing a fall is really important, but so is instructing clients how to get up from a fall if they do fall. Panic is often the first reaction, and how you react after a fall can sometimes cause more injuries than the fall itself. So getting up too quickly or in the wrong position could make an injury worse. So since panic is the first reaction, to instruct clients to take several deep breaths if they fall. Determine if they're hurt first. If they believe they're hurt, do not get up. Call 911 instead, or get help from a family member. But if you feel strong enough, follow these steps provided by the American Academy of Orthopedic Surgeons to get up. We do want people to get up as quickly as possible once they've fallen, but not too quickly. You do need to determine, am I strong enough to get up? Am I hurt? So you'd like to try to instruct people that if they're going to fall, to try to fall on your side or buttocks. Sometimes you haven't done that before somebody does fall. But to get up safely from a fall, they should roll over naturally, turning their head in the direction of the roll. If you can, get up on your hands and knees and crawl to some strong, stable furniture, like a chair, to pull yourself up on. Slowly begin to rise. Key is slowly. Bending whichever knee is stronger, keeping the other one on the floor and pushing up, and then slowly twisting to a sitting position in that chair. is a great way to instruct clients how to get up from a fall. Using something like a fall risk screening tool like the tug test is something really simple and easy. So you just need a stopwatch and you need to measure out 10 feet on the floor. And tug is the timed up and go test. And on the word go, you begin timing, and the client or patient gets up from a standard armchair and walks the 10 feet. And then you can really glean a lot from that. An older adult who takes 12 seconds or longer is at risk for falling. And also there's some observations that you can make while watching them walk. If they're taking really small shuffling steps instead of longer steps, if they have short strides or no arm swinging and things like that. So another cause of hospitalizations was medication mismanagement. Some ways that a specialty program can assist with medication management is assistance with filling pill boxes or giving medication reminders. Using medication bags, so having all the patient's medicines in a Ziploc bag for easy transport. They should be taking all of their medications to each of their doctor appointments, just so that each of their specialists knows what they're on exactly. And then giving out medication tip sheets to all patients or clients. Instructions for use for pill boxes as needed. Instructing caregivers to fill the pill boxes, even providing these pill boxes, maybe a part of your program. You can get medication pill boxes for less than a couple of dollars each. And then you could provide things like, as I said, the actual pill box, but some tip sheets for medication management, things like knowing where your meds are, having them all in the Ziploc bag, knowing what you take them for and what the dose is and when. Properly using the pill box and refilling the pill box, as well as even a medication tracking sheet to make sure that they're taking their medications. Improper disease management was another high risk for hospitalization. So some specialty programs can be developed that assist with disease management. And one of these might be home maintenance, providing safety enhancements in the home, like bathroom equipment, grab bars, or handheld shower heads. Improving or increasing lighting, decluttering, as I've already mentioned. Installing handrails or ramps in place of those couple of steps at the front door or back door. And then even providing routine repairs like smoke detector testing and changing out the batteries, as well as just some routine yard work that people need to get done. Telemonitoring can also play into this, and Medicaid does reimburse some telemonitoring, so you need to look into what is reimbursable by Medicaid for that. Senior safety calls, just making sure that what the home environment looks like, doing teletouch calls, just checking in with them. These can reduce depression. Maybe even we've noticed that by hopping on Zoom calls here lately while many of us are working from home, and actually seeing people and seeing faces really improves your mood and decreases depression, especially for the elderly that are at home and may have some chronic diseases and may be alone at home. Telehealth supports safety in several other ways, checking in on clients' disease management, giving oversight to caregivers, doing weekly tuck-in calls. So these evening or nighttime calls can really provide a world of information. You may identify a need for extra hours that wasn't realized before, but become evident when weekend tuck-in calls are implemented. And this can be especially true for dementia clients that, that nighttime sometimes brings increased confusion for many clients. client clinical indicators that you can identify through telehealth, and you can also detect early exacerbation of symptoms. So you could use a general safety type question for some teletouch calls, and then also you could use some disease-specific management questions for other telehealth calls. When deciding on specialty programs for new revenue streams, here's the steps to follow. Know your business, determine your market and needs, analyze your competitors. What is everybody else providing? You know, what's the need that maybe everybody else isn't providing? Set goals, outline your strategies, and determine your budget, and then get to work. So some senior safety service lines can include medication management, balance programs, tuck-in calls, as I mentioned, or sunshine calls in the mornings, telehealth, drink to your health. You could start or maybe implement into another program, a hydration program. As I mentioned, not eating or drinking enough is a cause of falls. So we know that seniors are often dehydrated. You know, the thirst mechanism doesn't work as well as we get older. So just improving hydration by encouraging intake of water. Care coordination, this could be during those transitional care programs from a hospital or rehab to the home. A home maintenance program, transportation program is really important, making sure that they get to appointments, whether that's a reminder of appointments or even providing the transportation to physician follow-up appointments, assistance with home management, and then meal prep as well. So market your program, train your caregivers, determine the value add for stakeholders, determine pay structure for your staff, and determine your cost of services. Building relationships with all those referral sources, whether that's rehabs or assisted living facilities or hospitals or doctor's offices, all those stakeholders that we talked about earlier. Use social media. Everybody's on it. People see things on there. It's a great way for marketing your program. And then also your typical marketing campaigns. And one of those might include something like this. For a transitional care program is a little flyer that highlights exactly what your transitional care encompasses, the range of activities that you'll provide. You can see here in the green that there is in-home safety interventions. They provide assistance with medication and DME in the home on the day of discharge, rehab care follow through with their home exercise program, medication reminders, medical appointment reminders, and transportation to appointments. Just showing that, you know, what the value add for having caregivers in the home can really help some of these other referral sources in this transitional care. So in summary, specialty programs promote the 3 pillars of success for private duty agencies. That's additional revenue streams for the agency and a method to promote your agency, career paths for employees and a method to retain people, and then through education and training, defining processes to ensure success. So that is what I have for you guys today, and I will kick it back over to Laura.
All right, Lisa, thank you so much. We appreciate you sharing your wisdom and your insight during this really challenging and evolving time for all of us in home care. If you asked a question, we will follow up with you via email. We are just about out of time. So I want to thank you for joining us today as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions. Have a wonderful day.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, Empowering care anytime, anywhere.